Hello and Assalamu alaikum. Ultrascan Diagnostics here. This is the CVCT of the patient that you had requested. The area of interest has not been mentioned, but we'll see all the edentulous spaces, starting with the upper right 7 segment, where there's an internal, there's a sinus cleft done, and as you can see, we've got 11 millimeters of ridge width with approximately 10 millimeters of height and good bone stability. We can see that the sinus is not perforated and the membrane is intact. This is the lower right 6 region. Again, D2 quality bone here. We've got very good ridge width, 9 millimeters of ridge width with 15 millimeters of height. Now moving to the region of the upper right 5. This is the upper right 5 region. As you can see, extracted area. But if we go slightly distally, we've got 7 millimeters of width with 9 millimeters of height in the region of the first premolar. Again, we've got good bone here. There we go. 7 millimeters of ridge width with 11 millimeters of height. Moving to the upper right canine region. Again, this is where the canine comes out from. If this area is grafted and there is a wall that is created on this aspect from here to here, then an implant can be placed. Otherwise, implant placement in this region is difficult. Then moving to the lateral region, again we've got good bone here. There we go. 7 millimeters of ridge width with 10 millimeters of height. In the central region, we've got again knife edge at the crest, 5 millimeters slightly below, and 9 millimeters of uh, length. This is the incisive canal. If we avoid it, this is the central on the other side. Now the central on the other side is snugly fit between an impacted canine and the incisive canal, 6 millimeters of width with 10 millimeters of height. Then we've got this canine which is impacted. Obviously, we're going to avoid this as at all costs. This is the region of the 4, and then this is the region of the 5 where we've got D4 quality bone, 7 millimeters of width, and if you're avoiding the canine, 10 millimeters of height. Then in the region of the 6, again, you've got a sinus lift procedure done right at the back here. You've got approximately 12 millimeters of width with a good 10 millimeters of height. And if we move to the region of the 6, again, you can see limited bone here, slight bit of a issue. Um, 7 millimeters of width with a good 7 millimeters of height. So here we don't have a buccal cortical plate. The doctor will have to engage in the parietal region because that's where the bone is. Thank you very much. Sorry, just to keep you up to speed to the lower arch, we've got again, this is the lower 6 region, very good D2 quality bone, 11 millimeters of width with 12 millimeters of height, and in the region of the 7 we've got again excellent bone here. Sorry, that was the region of the 5. This is now the region of the 6, D3 quality bone, 8 millimeters of ridge width with a good 16 millimeters of height, and in the region of the 7 we've got again D2 quality bone, 7 millimeters of ridge width and approximately 16 millimeters of height. So overall, all these areas are there is definitely a lot of work done for bone augmentation in the upper, and we've got naturally good bone in the lower, and hence implant placement in both the jaws is definitely possible. Thank you very much.